Hi, everyone. My name is Ann Mullally. I'm a physician scientist working on myeloproliferative neoplasms based in Boston. And today I'm going to talk to you about the development of monoclonal antibodies for myeloproliferative neoplasms. So we're in a very exciting time where we have seen new studies emerge for the development of monoclonal antibodies for the treatment of calreticulin mutant myeloproliferative neoplasms. So calreticulin is a particularly attractive target for a monoclonal antibody approach because the mutant protein has an altered sequence at the end of the protein that's not present in a normal protein, and therefore this is an attractive target because if you could develop an antibody against this mutant part of the protein, it would spare the normal cells. And so over the last number of years, we've seen the development of several monoclonal antibodies that have been tested in what we call preclinical models. So these are either in mouse models of myeloproliferative neoplasms or taking patient cells and testing them in the laboratory, or using cell lines that carry the calreticulin mutation and testing various antibodies in these model systems. And we have now seen a total of 4 antibodies in development. Some of these were presented at ASH, the American Society of Hematology meeting earlier, going back as far as 2020. Some have been published. And very excitingly, this year at the American Society of Hematology meeting, one of the plenary abstracts, so one of the top 6 abstracts from the meeting, will be on a monoclonal antibody that has been developed against the mutant C terminus of the mutant calreticulin protein. And in these mouse models, what these antibodies appear to do is they appear to bring down the platelet count, and they also appear to reduce the growth of cells that carry the calreticulin mutation. So if you assess the growth of these cells in the laboratory, these antibodies appear to block and inhibit that growth, and they appear to do it in a specific manner. So if you test the same antibody in a cell that doesn't have this calreticulin mutation, the antibody has no effect. So it seems to be very specific for this mutant calreticulin protein. And then this most recent abstract will be presented at the American Society of Hematology this year. The antibody seems to target cells in the bone marrow, so megakaryocytes, which are the key cells that are abnormal in calreticulin mutant myeloproliferative neoplasms, and also the stem cells, which are the cells that we know that are key to maintaining the disease over long periods of time. So all of this work is at preclinical stage, so we haven't seen any testing in patients yet, but hopefully in time these studies will move forward from the preclinical realm and into clinical trials. So I think it's a very exciting development around this area of monoclonal antibodies, specifically for targeting the mutant calreticulin protein in patients who have any type of calreticulin mutation as a cause of their myeloproliferative neoplasm.